This presentation is an introduction into the muscular system. The muscles of the body are divided into two divisions, the axial and appendicular muscles. The axial muscles help support and position the axial skeleton. Recall that the axial skeleton includes the skull, spine, and rib cage. The appendicular muscles support, brace, and move the limbs. The fascicles of skeletal muscles are arranged in several different arrangements or orientations. Recall that a fascicle is a bundle of muscle fibers surrounded by the perimysium. These arrangements include parallel, convergent, circular, and pinnate. Parallel fascicles all run in the same direction. One muscle with this type of arrangement is the biceps femoris. In the convergent arrangement, the beginning of the fascicles cover a wide area, but they all converge onto one tendon. The pectoralis major is an example of this arrangement. As the name suggests, in the circular arrangement, all the fascicles are going around an opening. Sometimes these muscles are called sphincters. The orbicularis oris and orbicularis oculi are examples of this type of arrangement. The pinnate arrangement actually has three subtypes: unipinnate, bipinnate, and multipinnate. Pinnate means feather, so the fascicles are coming onto the pinnate like a feather. If all the fascicles are coming to one side of the tendon, it is unipinnate. If fascicles join from two sides of the tendon, it is bipinnate. If there are several tendons that converge to an even larger tendon, it is referred to as multipinnate. Examples of multipinnate are the extensor digitorum, rectus femoris, and deltoid. Muscles attach to bones and allow movement. This movement is made more efficient because the bones act as levers. A lever is a rigid structure, like a bone, used to lift or pry something that pivots on a fixed point called a fulcrum. There are three types of levers based upon the position of the fulcrum, load, and applied force. A first-class lever has the fulcrum between the load and applied force. An everyday example of this is a seesaw. When one person uses their weight and goes down, it causes the other person to be lifted. There are a few of these types of levers in the body, but here we see an example of the posterior spinal muscles. The fulcrum is the atlas, or C1, where it articulates with the skull. The head is the load, and the muscles are the applied force. When the muscles contract, the head is pulled or lifted up. A second-class lever has a load between the fulcrum and the applied force. Think of a wheelbarrow. The wheel is the fulcrum, the load is in the bucket, located in the middle, and when you see the handles, you are applying force upward. In the body, an example is using the calf muscles to lift the legs up on the toes, which are acting as the fulcrum. The third-class lever system is the most common in the body. Here, the applied force is between the fulcrum and load. The biceps brachii are a common example of this type of lever. Notice that the elbow is the fulcrum and the load is the arm. You might want to imagine trying to lift a dumbbell or even a cup of coffee. The applied force is from the biceps brachii muscle, which attaches to the forearm close to the elbow. This allows the load to be moved a large distance without much applied force. To make understanding the location and action of muscles easier, there are a few guidelines that are used. The first is naming the muscle attachments. The origin is the end of the muscle on the immovable bone, and the insertion is the end attached to the moving bone. The movement that is performed by that muscle is called the action. For example, in the previous picture of the biceps brachii, notice that the muscle is attached to the bones of the shoulder joint and the radius. When performing a bicep curl, does the shoulder move or does the forearm move? The forearm moves, so that attachment is the insertion, and the shoulder attachment is the origin. The action described here is elbow flexion. Muscles very rarely work by themselves. However, one muscle might do most of the work, or at least get most of the credit for a specific action. This muscle is called the agonist, or prime mover. A muscle that counteracts or opposes the prime mover is called the antagonist. This is usually on the opposite side of the body or limb. Using our bicep curl example again, the bicep brachii is the agonist, and on the opposite side of the arm is the triceps brachii, which act as the antagonist. However, the roles will be reversed if you are doing the action of elbow extension. Now the triceps brachii is the agonist, and the biceps brachii is the antagonist. A synergist is a muscle that helps the prime mover. In this example, the brachialis muscle will be a synergist. And last, there is a fixator. This muscle will help stabilize or prevent movement at a joint. This makes it easier for the agonist to work. Muscles can also be named based on a few other criteria, such as the location in the body, the fascicle organization, the relative size or position of the muscle, its attachments, its actions, or some other distinguishing characteristic. For example, the muscle names biceps brachii and biceps femoris give us clues about their location. Brachii refers to the region of the arm between the shoulder and the elbow, and femoris refers to the thigh, where the femur is located. Both muscles begin with the term biceps, which means there are two heads or origins. The muscle rectus abdominis tells us that the muscle is located in the abdominal region, and the term rectus means straight, which describes the fascicle arrangement. For relative size, we use terms such as major and minor, or maximus, medius, and minimus. Relative position is related by terms such as superficialis or medialis. To name a muscle by its attachments, let's look at the muscle, the sternocleidomastoid, or sometimes SCM. Sterno refers to the sternum, cleido refers to the clavicle, and mastoid is the mastoid process. So this muscle has attachments at all three places. The muscle pronator teres tells us that this muscle will pronate the arm, or turn the palm down, and teres means round. Knowing these terms will be very helpful in locating and naming muscles.